And now joining us to talk from Los Angeles about World AIDS Day and the fight against HIV/AIDS is Michael Weinstein, president of AIDS Healthcare Foundation, a global nonprofit organization. Welcome. I know it's been a very busy day for you. Thanks very much for coming in.
Thank you.
I want to talk about, for people as old as me who remember the 1980s and being diagnosed with HIV or AIDS, it was grim. It was a death sentence. But things have changed a lot in 30 years. If we look outside the window here in Washington, D.C., we can see a giant red AIDS awareness ribbon from the White House. And we think back to when the government was accused of burying its head in the sand and holding up funding. How have things changed?
Well, one of the great achievements of humankind in this last generation has been the fact that we're now treating 10 million people with HIV across the globe. And that number was only about 1 million in 2002 when the Global AIDS Program was announced by President Bush, the PEPFAR program. So we've made a lot of progress, but we have to keep in mind that there are 35 million people with HIV, and the vast majority of them are not being treated, and most of them still don't know that they're positive. So there's a tremendous amount of work to be done. The war against AIDS has not been won, but there are still more than 4,000 people dying every single day of HIV in the world.
That's sobering information, hardly a time to rest on laurels, as you say. The tragedy that's going on in Africa, as we just saw in our recent report, nearly 2/3 of global cases on that continent, and roughly 3 out of 4 AIDS patients who die from Africa. How can we turn this around?
Well, I think that a lot of it has to do with political leadership. And I think what you see when you compare one country to another is that there's better leadership in some countries than others. That's one thing. I think just the symbolism of, for example, the president of Uganda in the last couple of weeks got tested himself. And that's very, very beneficial. But I think beyond that, we have to provide the funding, whatever funding is necessary. And it's lagging in terms of the United States' contribution. I mean, it has gone down under the Obama administration, and that's unfortunate. And there'll be a replenishment meeting going on this week for the Global Fund, which is the main body that provides funding for TB, malaria, and HIV. So I think that the total price of controlling HIV, which is within reach, is much less than many other enterprises that go on the face of the globe. And I think we will be judged 20 years from now whether we won the war against AIDS or we retreated.
Yeah, let's pick up on that. I'm stunned to hear that funding has gone down. You know, World AIDS Day, people come out, they make these glorious speeches. The president hangs the red awareness ribbon from the White House. Why the cutback in funding here in the United States?
Well, I think that President Obama has not had the same commitment to the issue of AIDS that President Bush had. I think it was a dramatic thing when Bush announced the Global AIDS Program. It was sort of like Nixon going to China. And I think that this administration has not had the same ownership of the issue for whatever the reasons are. But there's a grassroots movement across the globe that is mobilized and will continue to be the conscience of the world. So I'm optimistic. Again, the fact that we're treating 10 million people, the fact that the number of people getting infected is going down, that the deaths are going down, those are all tremendous accomplishments. We just have to keep people accountable to the goal that we had, which is to control this disease and one day to cure it. And there's no reason to rest now.
You know, Michael, one thing that jumps out, the staggering number of children who suffer from HIV or AIDS.
Yeah, definitely. I mean, there shouldn't be a single child born with HIV. We have the ability to prevent all mother-to-child transmission by treating the mothers during pregnancy. So that's a total waste that we have children being born. And that's something that can easily be achieved. In the United States, there really are no babies being born, very, very few with HIV. And I think if we mobilize around the world, we could end that in the next 5 years.
Okay, Michael, quickly, I have to ask you, here in the U.S., has the Affordable Health Care Act been a hindrance at all?
I wouldn't say that it's a hindrance. I just think that it's a big transition, and it's going to change the care system. And the previous system was based upon specialization in HIV, as having AIDS clinics. And my worry is that when you send people into all these HMOs and health plans, will they continue to get that kind of specialized care? It's going to be a rocky transition. If we recognize the fact that we need specialists to treat this disease, then I think we can make it a success. But it remains to be seen how it's going to be implemented.
Okay, Michael Weinstein, thanks very much. Keep fighting the good fight, and we greatly appreciate you coming on, updating us.